Peter, thank you for that overview of the report's findings and recommendations. There's a fair bit to unpack there, so I'm very pleased to welcome onto stage Peter's fellow panellists. Let me introduce them. Jillian Broadbent is one of Australia's best-known corporate leaders. Come up, grab a seat, Jillian. Jillian served 5 years on the board of the Reserve Bank, was the chair of the Clean... 15 years. 5 there, sorry, I'm just going to...
I'll take 5, I look younger.
15 years, how about that? Chair of the Clean Energy Finance Corporation. She served on the boards of Qantas, Westfield, Woodside, Woolworths. You get the picture. And was Chancellor of the University of Wollongong for 11 years. Got that? Great. Isobel Marshall is a social entrepreneur and was Young Australian of the Year last year. She co-founded Taboo at just 18, helping women around the world break down stigma around menstruation and providing high-quality, ethically sourced products along the way, raising funds to help women and girls in Uganda and Sierra Leone. She's also studying medicine at the University of Adelaide. And finally, Peter Varghese is a former diplomat. He served in posts all around the world. I won't list all of them because that will take some time, but he was High Commissioner in Malaysia and in India. He served as Secretary of the Department of Foreign Affairs and was also head of the Office of National Assessments. And since 2016, he's been the Chancellor of the University of Queensland. So, well-credentialed panel, please make them welcome. Look, thank you all. Peter, I might start with you just to pick up on what you identified as the single biggest failure of our management of this pandemic, this deepest fault line, as you called it just now, that societal fault line. What are you suggesting needs to be done to better address this? Are you suggesting when it comes to these areas of disadvantage, migrants, Indigenous Australians, people with a disability, low SES students, older Australians, are you suggesting that generally we need to do better at addressing disadvantage at all time, or specifically when a pandemic strikes, we need to do more to protect these people?
I think we need to do more generally. Let me come to that. But I think in going into any crisis, actually, whether it's a health crisis, whether it's flooding, whether it's bushfires, we need to start from day one with the expectation that not all Australians are going to be affected equally. Some are going to have particular vulnerabilities. So the first thing in planning, in preparing, in doing scenario testing is to get those groups front and foremost. But to do that, you can't just start when the pandemic starts. We really need to be doing more. Now, public services actually know this. Many of them in various ways are doing more to be more open generally. So there's two things we need to do. We need to make sure that on any decisions, the functional silos that exist across governments and the jurisdictional silos that exist between governments are being worked collaboratively. And it's much easier to do that now than when the crisis occurred. The other thing we've got to do is to make sure that we are much better at talking to civil society and business generally, so that when it comes to a crisis, we've got those networks that we can use.
When it comes to some of the problems, I mean, you talked powerfully there about the foreign students and other migrant workers who were left high and dry, felt abandoned, as you said. It's not like there weren't calls at the time to help them out. I mean, I remember we were all reporting on it. Why did you get to the bottom of why that didn't happen? Was it money? Was it some mindset? Was it politics?
I'm sure that in part they were thinking this is going to cost us a huge amount, and there are financial constraints, and therefore people who are here temporarily, they should go home. How? How will they go home? I mean, most of them didn't have the resources. They were worried if they went home, incidentally, they would lose their visas by going home. They were continuing to study. So I think it should have been obvious that that was a real weakness. And remember, these weren't just migrants who were sitting here. We're talking about these temporary migrants who were essential to our labour force. Many of the areas we're now looking at, we're saying we're short of workers, those were precisely the areas that those temporary migrants and international students were working.
Jillian, let's look at some of the areas where you say Australia could have done better. Number one, economic supports should have been provided fairly and equitably. Are you saying they weren't?
Well, I think with regard to JobKeeper,
the government responded very quickly, and that was a positive thing of abandoning a balanced budget and realising JobKeeper was a very good mechanism. And New Zealand and the UK had followed a similar policy. But where that policy was deficient in our mind was the exclusions from it. So it excluded transient workers, non-resident student workers, as Peter said, workers who were integral to the whole labour force of Australia. And they were excluded. And in addition, we didn't have a clawback mechanism. So when the policy came in 2 weeks after lockdown, so that was good that it was timely, but it was if you reasonably expect your gross turnover to be down by 30%, claim JobKeeper. Well, that's fine because nobody had any reasonably expected, you had no idea of what to expect. So there were many claims that weren't necessarily justified, but that was reasonable that they were claimed. But where the deficiency came was that there was no clawback mechanism.
You see, the Treasurer at the time, Josh Frydenberg, I remember asking him about this, and he would argue that, well, businesses, as you say, were standing at the abyss. They needed confidence and certainty to keep investing and keep running their business. A clawback mechanism might have prevented them from doing so. What do you say to that argument?
I disagree with it totally. At the time, to say reasonably expect, all businesses would say, yes, I must take this JobKeeper, but would also be reasonable to expect that if you took the JobKeeper and your expectations didn't come through, then you would pass it back.
What about a retrospective clawback of that JobKeeper? Has that ship sailed? Is it too late?
Oh, I think that ship sailed.
Okay. Worth asking. Okay, let me ask you, Isobel, about schools, because this has been, well, it has been throughout the pandemic, one of the more controversial elements, closing down schools. You say in the report, schools should have stayed open. How have you arrived at that conclusion?
I think we all understood and agreed that school closures are a really important tool to have in the toolbox of responding to a pandemic. I'm trying to liken it to a certain tool, but I actually don't know anything about any toolboxes. But they need to be used particularly when, like border controls and lockdowns, when little is known about the disease, how it spreads in a community, the people that it targets, things like that. Of course, you're going to make sure teachers and students are safe. That's completely reasonable. But what we found is that when growing evidence came about, we now have really good case studies from Sweden. There's been numerous reports now that show us that the transmission rates were low in schools, and we can use that to our advantage and use that as information to guide future decisions. I guess when we come to that point of trade-offs that we've been talking about, it's a key buzzword for this report, is that we know the very real and significant impact that school closures had on every member of this community. Definitely the students and the kids. Obviously, there's a huge impact there on the education levels. What we know is that different students had very different environments at home, whether their families were able to afford the technology, as Peter was describing, that digital divide, that really came to the floor in this sort of situation, but also the students' access to the parents that were available to assist, to act as supervisors and teachers at the same time, whilst juggling the adjustments of their own work life being so drastically changed. So there's all that tension at home, there's pressures on the parents as well, and these had real impacts on the mental health of students, the mental health of households, educational outcomes, of course, with assessments really reflecting factors that were completely out of the children's control. But also just missed opportunities in terms of social milestones, friendships that were formed, that weren't formed, graduations, gap years. I was at school 6 years ago, and I gained so much from my everyday interactions with teachers, with the networks, with people that would inspire my career decisions afterwards, and then coming into the uni phase as well, meeting lecturers, meeting people who were in the career and the industries that I was interested in. That really grows confidence and it grows excitement as well. What we found is that lots of young people also left uni and didn't really struggle to maintain excitement and confidence in those spaces, because it's impossible to do it alone in your own bedroom on a laptop.
Now, sure is. Let me just come back, though, to this question around school closures. Are you saying that it was justified to close individual schools or even schools in a local government area, but not a statewide systemic school closure? Is that the argument?
Yeah, exactly. And so
at any point, do you think that was warranted to have the statewide closures?
It comes back to the information you have access to. At the time, we are arguing that whole states shouldn't be closed down, or whole school states shouldn't be closed down, but taking a more targeted approach and more geographically specific. But that comes back to having the data and the information at hand, which really speaks to the 6 recommendations. That's about establishing the CDC, the interjurisdictional communications, the networks, the data, and that kind of creates the framework to then go about a much more targeted approach to really any of the policies that we're talking about.
I mean, Peter, I might bring you back in on this as well, and anyone else who wants to chip in, because I remember as a parent during the pandemic, there were periods of great concern where parents were deciding not to send their kids to school themselves, so they were making their own decision. Classrooms were emptying out because of this self-regulation, I suppose, for parents. There were concerns about kids getting it. There were concerns too for teachers and the exposure they might face as well. And no doubt teachers' unions were influential in letting state governments know what they thought. Peter, if schools had remained open, is there a risk, though, that teachers might have been exposed, that classrooms might have been half full, that this wouldn't have been ideal?
Yeah, look, this was undoubtedly tricky. I think it's fair to say that state governments started to respond to their concerns about parents keeping their children away from school. And that's because parents were hearing, rightfully, the message about social distancing and how you could do it at schools. But we do have to go back. The evidence is clearer now. But I have to say the evidence was, I think, clear at the time in pandemic quite early on.
How early on do you think was this clear, that closing schools system?
I am certain that near the start, when the Commonwealth government were looking at this, they were, in their views, was that the costs of shutting down school systems was greater than the benefits. And it was state governments, I think, responding to parents who decided not. So I think what we would do now is to say, yes, of course, there may come, of course, occasions where you'd have to shut down schools for particular periods. But we do know, and to some extent we did know, that schools had the capacity, with proper safety arrangements, with proper social distancing, that they could stay open. At the very least, we say you could stay open for essential workers. Well, that's one thing. What we should have said is vulnerable children. These children that Isobel's talked about, who didn't have access to laptops and computers and were trying to work in a room with 3 other children, those vulnerable children certainly should have had schools they could attend. So
it's your understanding the Commonwealth had a different view on this?
My understanding is that the Commonwealth's advice was that it was that the cost of shutting down schools at that time outweighed the potential benefits, and that there were ways in which you could manage the pandemic in schools that would not place either children or teachers at additional risk. I think we did know pretty quickly that children, young people, seemed to be less susceptible to the pandemic, and when they did catch it, their extreme responses to the pandemic tended to be less than it was for adults.
Isobel, do you think this is accepted now, that these school closures were a mistake?
In the general community?
Yeah, and in the governments and school systems that have made these decisions?
They weren't all a mistake, and I think that I probably didn't make that clear enough. People don't deserve to go to work or to school if it's going to be an unsafe environment. But I think now that we, in retrospect, can appreciate the longer-term impacts, we can make more informed decisions in the future. And so potentially those system-wide approaches and the length of time that they were closed for, potential overreach, and we've discussed the perils of overreach, and I think that's one example.
It is worth saying, I think, teachers themselves do this extraordinary job. I mean, if you had talked to teachers a few weeks before the pandemic and would say, we're going to move almost instantly to online teaching using digital resources, it would have been impossible to imagine. They did an extraordinary job. In fact, the evidence suggests that teachers ended up doing 4 hours extra a week doing online teaching. So that's not the issue here. It is that however well we did it, and teachers did it the very best of their ability, the inequitable impacts of that are profound. And what we know now is the medium and long-term consequences to those children, not just in terms of educational disruption, but in terms of social development and in terms of mental anxiety, is now becoming very clear.
Yeah, and it's a good point that we should recognise the extraordinary work that teachers did, and
Absolutely.
Parents who got to see what they do on the screen got a
One of
new
the good things that
appreciation.
came out of this pandemic is we got a really good idea of
Exactly.
what essential workers were and frontline workers were, and they weren't all the people we expected.
Peter, the school closures were, of course, a consequence of the lockdowns typically. Let's talk about these. The report says lockdowns and border closures were overused, costly, and in many cases avoidable. Tell me how you've reached that conclusion.
Well, look, when you're dealing with something like COVID, which nobody knew anything about, you didn't know how your quarantine system would operate, your contact tracing was an untested proposition, there was a very plausible case to go down the lockdown path. And as Peter indicated in his opening remarks, that should have been used to buy you the time to get all of those other bits and pieces into place so that you don't need a lockdown. I mean, Izzy spoke about a toolbox. A lockdown is a sledgehammer, whereas all of those other elements are probably scalpels in terms of how you're trying to deal with it. So to our mind, there was no question that there was a place for lockdown. The cost of it is obvious. I mean, you're dealing here with shutting down a very, very complicated ecosystem. And a lot of what our reflections go to is the fact that you make that threshold decision and it has all sorts of consequences down the path. So we should have not gone back to lockdowns except in the most dire of circumstances. And the reason we did go back to lockdowns, as Peter indicated, was that we didn't actually get those other things completely right. Quarantine, testing, focusing on the vulnerable. When vaccines came along, the rollout of the vaccines, I mean, these are all part of one coordinated picture, and the cost of lockdowns is so excessive that it should have been used less, and it certainly was in many cases avoidable.
Did they work though in limiting case numbers and saving lives?
Oh, that's if the criteria is limiting case numbers, of course lockdown's going to work.
And saving lives?
It depends on where in the story you are. I mean, the thing about the COVID story, which isn't finished, by the way, it's a continuing story, is that at different points in this, you needed different approaches and different toolkits, and you needed to learn from what went before.
Well, I guess then let's look at those points where we did have very long lockdowns in 2020 and 2021 in particular. Did they save lives or were they too costly?
Well, these are on-balance judgments. Did they save lives? Yes, you could make a very plausible case that they saved lives. But policy making is all about trade-offs. I mean, this may sound harsh. It's not meant to sound harsh. But you have to make decisions across a whole range of factors. And once you decide to go down lockdowns, you commit yourself to a whole range of consequences. And the question is, could you handle it differently? And we're arguing that at some points in the course of the story, it could have been handled without further lockdowns.
What point was that?
Well, I think, in 2020, obviously, when we were really in a fog of uncertainty about everything, it made sense. That sense starts to decline into 2021, when we did know more and we had the opportunity to get these other parts of the strategy better in place than we did.
So just to be clear on this, because this is an important point, is the view of your review that the 2021 lockdowns and all that flowed from that, school closures and so on, were unnecessary?
It is certainly our view that we wasted a great deal of the time when we had lockdowns in 2020 to set things up. Think of how long we never did effectively set up quarantine arrangements in a way that worked very effectively. We took a long time to get to vaccines, which would come, and frankly, our distribution of those vaccines was pretty poor. It took a long time to get to contact tracing. You just think back, you would have thought we'd have learned from that, and then what did we find? We still find that we've got to keep lockdowns in place because actually we haven't got the supply of rat tests.
So given that the problems with not having sufficient quarantine and vaccines and so on, again, were the 2021 lockdowns necessary?
The reason I can't answer this, I think it depends state to state and area to area. What we can say categorically is that these are a useful tool at the beginning, but they're a tool to buy time to set in place. That's what, in fact, you think about it, we've done now. We have now moved to a situation, and we would have always known that at the point you start to remove lockdown and border closures, you're prepared as you can be, you've got high levels of vaccination, we did well. We've taken at least some of the pressure off hospitals. You always know that at that stage, the incidence of COVID and deaths from COVID will increase. We've now come to, I think, a decision across across governments that this is how now we're going to manage it. Could we have done that earlier? I think our judgment is absolutely yes, if we'd used our time better.
What about border closures? Peter, the international border closure at the early stage of COVID was pointed to by Scott Morrison and his government for long after, saying that was a critical move in saving Australia from some of the worst of COVID that we saw elsewhere. Is that correct? Should the international border have remained closed as long as it was? And I'll come to state border closures after that, but on the international border first.
I think the initial decision to close our border early in the piece was a sensible decision, and I think it holds up well in retrospect as well. The question of whether we kept our international borders closed for longer than we need to, my personal view is, and I think this is also the review's view, is that we kept it closed for far too long. I mean, we kept it closed even when COVID rates in Australia were expanding significantly. And so the added risk that you have from an open international border with a quarantine system would not, in our view, have justified closing the border. And closing a border is a very big step. I mean, it's not something you do lightly.
Well, indeed, and certainly for a period there, Australians were even prevented from returning home from overseas. What about the state borders? Should any state borders have been closed throughout this?
Well, look, in the end, the decisions to close state borders reflects the complete absence of an effective national approach to the handling of COVID. So I see the closure of state borders as signifying two things. One is that we didn't have an effective national approach, notwithstanding the efforts through National Cabinet to arrive at one. But secondly, it's bracketed with lockdowns. I mean, state border closures and lockdowns are conceptually sort of tied. State governments made the decision to close borders because that was a further manifestation of a lockdown. So it gets you back to whether those lockdowns in all circumstances were justified as often as they were.
You do note in the report, where is it? Politics also played a role.
Sure. Well, I'll give you a scoop, David. Premiers and Prime Minister caught engaging in open politics. I mean, look, the issue here isn't that politics played a role. Politics plays a role in every serious decisions that government takes. And if you're living in an accountable democracy, it is both naive and undesirable to strip politics away from the equation.
I think that's an important point, right? Because the community, certainly I went through the pandemic in Melbourne. The community there very much at points wanted those lockdowns. I think that needs to be said. And
Absolutely. And in 2020, the political incentives was to overreach. And the political incentive was to overreach because the level of anxiety and fear in the community, fueled by images on television of hospitals in countries that, Australians knew well and often associated with in Europe and North America, patients grasping for breath, the lack of ventilators, overcrowded hospitals, mass graves dug in New York. I mean, this scared people. And so overreach was a response to community sentiment.
Which then shifted, of course.
Which then shifted, and it reinforces the political calculation that sat behind a lot of these decisions. So in 2020, overreach is politically rewarded in many ways. Today, we've gone from harsh, mandatory health orders to personal choice. Now, the health advice probably hasn't shifted all that much between one and the other, but certainly the political calculation has. And look, the point I'd make, David, is the issue isn't the presence of politics. I mean, we all understand the presence of politics. The issue is the absence of transparency. And the reason that's an issue is that you don't know where politics begins and expert advice ends. And that's why we've made so many recommendations to say, make as much of this public as possible.
Well, this was a particular point that brought me much joy reading the report as a journalist, the frustration we have at not getting enough transparency. Can I just invite anybody else to comment on this as well? Why couldn't the materials, the evidence, the advice that National Cabinet was relying on to make all of these decisions be made public?
Look, going back to 20 years as a public servant, if you're going to give frank and fearless advice, you can do it best at times within an environment of confidentiality. If I'm telling you there are 4 possible courses of action you can take and this is what I recommend, I think that is entirely appropriate to be confidential. What was wrong here, remember, is that we often got politicians using public health officials to say that on the basis of this public health advice, these decisions were being made. So I'm not asking for the 2-page brief of the public servants to the Premier or the Prime Minister to be made public. What we are saying is that the evidence on which these public health decisions are being made needs to be open, not just for public trust, but so that others can interrogate that data to see if this is actually the basis on which we're making decisions and is it right. Now, we did that a little bit. Some of the advice we did make public. The truth is much of it didn't. The other thing that became very difficult, of course, as National Cabinet went on, is that I think at first people had this enormous faith, and I was really pleased about this, in the public health officials who were appearing. I think that over time people started to say, it seems to be quite remarkable the extent to which the public health advice seems to be gelling exactly with the political leader they're working with. And you start to wonder, and of course you see that people are taking different decisions on that public health advice. That again is inappropriate. But we didn't know, what is it? Is it that they're interpreting the same evidence differently, or have they got access to different evidence?
I think the other element that was deficient was an articulation of the trade-offs. So as time went on, recognising, when you talked about school closures, I think it took 5 million people out of the workforce. I mean, the economic implications have social costs, not just lives of people. That was the single variable. As soon as you were asked, as Peter said, he doesn't want to be insensitive, but lives were one element, but then there was the well-being of the whole economy and the citizens. And you say, well, there are trade-offs. Unfortunately, in economic policy, there are trade-offs. And those trade-offs never seem to be articulated whether they were calculated or considered, but I thought they could have, I think we agree, they could have been put in a package where there was a better understanding of the complexity of policy at these times.
And David, the other thing you said was, did lockdown save lives? And Peter was responding to it. But so many of the other things in our report could have saved lives. Mm. If we dealt differently with residential aged care in 2020, we could have saved lives. You can save lives in a whole variety of different ways. You know, lockdown, we started to think, was almost the only answer and was the long-lasting answer, instead of a time to have the opportunity to put other things in place.
Yeah, and can I also just jump in there to say that if life and health is the goal, that isn't just determined by whether you have COVID or not. There's so many determinants of health that are like social determinants of health, financial, your financial position and how that impacts your health, delayed diagnosis. That was a huge issue as well. It's not just so black and white, I guess. Can I also just say one other thing? Yeah. Sorry, I just was holding on to it as the token member of the TikTok generation on the panel here. I just wanted to make a mention.
I hear Peter's quite a TikToker, but
sorry. He'd pop off, honestly. But I also wanted to make a point to that transparency topic. When there were gaps in information, the fake news that just ran through social media was really damaging, and people will fill those gaps with whatever they want to fill them with, and that can be really detrimental to the way people then comply with health orders as well. And
give us an example of that.
What would be an example? The lockdowns even, or any of these these policies that we implemented when the trade-offs weren't, or when the reasoning wasn't described or explained properly, and people were just getting these big rules placed over their lives and their households and their communities, and a lot of people don't have an education in politics. I know I don't. I learned a lot on this panel, this whole process, but I didn't know a lot of these nuances and the whole network that we're all a part of, being in this country and in states and in communities and societies. It's a lot more complicated than you think. I used to think I'd just walk down the street and I was all safe because it was just the way life was. You're safe because of so many different components and so many policies and protocols, and I don't think the general public knows that to the extent that perhaps decision makers think they might, and so they'll fill the gaps with fake news.
I want to get some questions from the floor, and I'm sure we have some, so we'll get the microphones there. But can I just come back to older Australians, Peter, because you mentioned this, and really we knew the problems in aged care well before COVID came along. We had a Royal Commission report not long, in fact, a Royal Commission that had commenced not long before COVID came along. Can I ask you, though, about the current situation? Because you also noted that in 2022, where we were ahead of the pack in terms of OECD rankings, that seems to have shifted a little now in 2022 in terms of case numbers, and a lot of the deaths we're having in Australia are still amongst older Australians. Are we currently getting it right? Have we learned anything through the last couple of years?
Well, I think we're getting it righter. I think we are learning some lessons. One of the lessons is a more general one. I think that governments should actually be willing to learn, not just in designing policy, not just in communicating, but delivering. I mean, so often you'd look at things like, distribution of vaccines. Can I say, aged care homes had a lot of experience in that. They were doing it every year for flu. Too often, governments have this tendency to start reinventing the wheel, bringing groups of really bright young public servants together and doing it and then announcing it, rather than saying, hang on a moment, if we want to talk about logistics, why don't we talk to Coles and Bunnings? If we want to talk about vaccine distribution, why don't we talk to hospitals and aged care homes? We've got to learn from that. I think we are getting better. Obviously, people who are old are more likely to die of COVID, and that's largely because they have more comorbidities. People in residential care communities are more likely because they've gone there because they are frail, physically frail, or because of memory loss. I'd have to say one of the frustrations, I think, is, and in a way it comes from this wrong image, partly out of the Royal Commission, about aged care homes, that somehow they're just hospitals in which you put your loved ones for the last 6 months of their life. They're not that. They are care communities. They're designed as care communities. And yes, of course, you provide a lot of medical support, but they're not hospitals. They don't, easily spread diseases moving around. You imagine in, aged care homes where half of the residents have dementia of some form or another, telling them why they've got to move into different areas or stay within their own rooms. So I think what we did at the beginning, is to have those assumptions, well, if you're in an aged care home, it was like a hospital to leave you there. In fact, what happened, therefore, of course, is it spread often very extensively between residents and for the essential frontline workers who work there. And sometimes we did it because we thought, well, we've only got so many beds and ICUs and they could be overwhelmed. But actually, we were saving beds when they were available. It wasn't so that, you can't send someone from a residential aged care because there's no bed. It was a sort of saving it for the future. Now, what does that tell you about how you're making ethical decisions about whose life you're trying to save here? So I think we have got much better. I think there's a much better system now in place with all, both the Commonwealth and state jurisdictions, in knowing when is the right time and in what circumstances to be able to send someone who has got COVID into a hospital environment.
We talked earlier about teachers being essential workers and the extraordinary work they did. What about doctors and nurses, particularly in the hospital system? We're still seeing, I think, the consequence, many leaving the sector simply because of the strain they've been under for years now, thanks to COVID. It comes back to the lockdown question too. A lot of the lockdowns were justified because we had to ensure hospitals weren't overwhelmed and these frontline workers weren't overwhelmed. You would have heard through the review from those working on the front line. What are your impressions now about what we do next time this comes around? Do we need much bigger hospital systems? How do we manage this? How do we ensure that not too much is put on our hospital system?
Well, I think one of the very good things that came out of this is we started to realise essential workers. And yes, they are the courageous nurses and people who work on the front line in aged care homes and hospitals. They are teachers. But what we realised, in fact, essential workers are the people who are serving us in Coles. Essential workers are the people who are driving the trucks. We start to realise, and I think it gave us a pause for thought about how we value effort in Australia.
But it's nurses who have to wear the full
impact.
PPE and they're still doing it for extraordinarily long shifts.
It's extraordinary. And look, and of course, the more people leave, the greater pressure. Undoubtedly, there's still very long time to get visas through to bring additional teachers and nurses and aged care workers in is a problem. But there is no doubt it's had an effect. I can tell you at Western Sydney University, we run a major nursing program. And we have started to see significant dropouts in the nursing program, which doesn't happen normally. And it's because people have been, obviously, to some extent involved in that. But they're actually thinking, right now, this is too hard. This is not the occupation we want to go. So there is this challenge. I think we've got to provide much greater support for those, frontline workers. And the ones we know are under, extraordinary pressure, have been under that pressure now for 3 years.
They have. Okay, we've got a question. Oh, sorry, we've got a microphone. Yeah, just here. G'day.
Peter, I'd be interested. I'm Paul Zara, the CEO of the Australian Retailers Association. The big issue that we saw was the lack of a national framework and having the state-based decision-making. And what that did was even just the language used between the states. So what was defined as an essential retail store in Melbourne was very different to what was in New South Wales. What was defined as a lockdown in Victoria was very different to New South Wales. So lockdown, hotspots, all this new language and the confusion, the anxiety, the stress it created, not only for the retail community, but for consumers at large. So it'd be interested in your report how you see the differences between the levels of government and how we could operate consistently and better.
Of course, one of the fault lines everybody would see in this is, we have a federal system of government, and we're going to live with a federal system of government, and it's got advantages. States can, do best practice, and we can learn from each other. But I'd have to say that most people, if there was a benefit most people initially saw to this crisis, is that the crisis might bring us together, and that national cabinet could be there and would bring together the heads, and we would have a national approach. Now, then there was increasingly frustration when that didn't happen. Now, some of this, though, is not highly, if I may say, politically sensitive. The issues you're talking about there, about how will we define an essential worker? And how will we make sure that when you're running a store in one state, you can do it on the same as that? In my view, those are things right now you can plan for the next pandemic. You can work out with the states, when this comes about, how are we going to address this in a national way? In a sense, it was because we didn't, it's no use having, as I keep saying, plans and then not wargaming them. If you played this out, you would have seen, well, these are essential defects. So a lot of the pain, if you will, of federation, through proper planning, you could overcome. And we could get to more likely, genuinely, national decisions. But that imposed, as you would know, I think, huge unnecessary costs on business at that time of crisis.
Bunnings in Victoria couldn't open, yet in New South Wales you could. So if you had a repair to your home or had to replace a heater or a fridge or etc., you couldn't do it in Victoria, but in New South Wales you could. Some stores actually sold merchandise across categories, so things were just warded off. You could walk into a Harvey Norman store, buy an office supply, but you couldn't buy a piece of furniture. It was just absolutely craziness.
And Paul, as we listen to that, we think, oh, my gosh, is that really highly political? Of course we don't think that. I mean, this is not highly political. These are the things that you can work out. I mean, it was ludicrous that, Isobel couldn't buy her toolkit in Victoria, but Peter could buy his sledgehammer in Queensland.
I think the bottle shops were open everywhere, though. So, National Cabinet, though, did it work as a functioning body? Some quick thoughts from everybody on that.
So I think one of the things, our view is that at a time of crisis, it would have been quite beneficial to have brought the Leader of the Opposition into National Cabinet.
Interesting.
It probably could have helped ameliorate some of these issues. I think initially, it worked pretty well. And over time, as Peter has expressed so well, if you like, normal businesses returns, normal politics returns. I think it is a step forward compared with COAG. We know about the COAG of deficiencies. I think it is very useful that we are going to try and keep National Cabinet going through these times, because I think that then gives us the opportunity. But I tell you, one of the key things that I think they've got to do at National Cabinet is that it would be great if all leaders could decide collectively that they are going to give the authorising environment for their public servants to work together as much as possible in these, not crisis times, to actually give them the authority to do so. I think the other thing is, there are parts of the frustration is where you actually we've got quite good legislation now on data sharing. Are we data sharing? Are we buggery? No, we're not. We've still got to get... So that's why it's not just a matter of a guideline or a piece of legislation. It is also getting the authorising from the top that we actually see a benefit in this sharing of data.
Which comes to the Centre for Disease Control. We won't delve into that. Just quickly on National Cabinet, though, Jillian.
Well, on National Cabinet, I'm sure everyone shared the view of a sense of relief. We're going to have a cooperation, we're going to get through this together. And there was a short window where the whole nation would have pulled behind and felt this is a bad situation, but we can get through it. And I think it became politicised too readily, and as the report identified, we felt the absence of making it apolitical from the start. I mean, in a war cabinet, you always have the head of the opposition there. This was a very serious issue facing an epidemic, and to have included the head of the opposition would have been a courtesy and a message to the general population. This is not a political situation. It's something where we all have to lean in. And I think that opportunity was lost, and it fed through in the policies and the politicisation that occurred between the states.
Yeah. Peter, did you want to add anything on that?
Look, I think the instinct behind the National Cabinet was a very good one, and when you bear in mind that what it replaced, COAG, was a very ordinary mechanism. I mean, people say COAG is where good ideas go to die, and that's usually been the experience. But did it work in the way that perhaps the Prime Minister intended it to work? Look, I think the optics of National Cabinet were good. The substance was much, much less good.
Interesting. Yes, another question here.
Yeah, hi. I'm Nicole Breeze from UNICEF Australia. Firstly, I just wanted to acknowledge how important the focus on schools is in the report, and thank you for acknowledging that. We saw how severe those consequences were for children and young Australians. But I actually just wanted to ask you about the vaccine rollout and to ask what did the panel learn through its inquiry about that component, because that was pretty important in terms of the focus on saving lives and livelihood. Curious to know.
Yeah, who wants to have a go at that, the vaccine?
I'll start and then hand over. So when I look back, I was asked, I think, right at the court, how do you think we performed? Actually, if you look at the data now, the thing we are still have done a really good job on is vaccination rates. And it's extraordinary. I tell you, one of the areas we did really well, eventually, was in vaccination rates in high migrant communities. Now, initially, we got it really wrong. We thought, oh, well, we'll translate a leaflet into Arabic and we've done our communication. What we actually discovered through that is if you work, as in Sydney, for example, with the community and religious leaders in Canterbury, Bankstown and so on, where vaccination rates were low, we got very high rates. Compare that with the United States or the United Kingdom, where high migrant areas still ended up with very low vaccination rates. So I think we staggered to get there, to be honest, not just because it took us a long time to get the vaccines, and not just because then many of us got scared off with the vaccine that was most available, but just actually arranging the logistics and distribution of vaccines. That's why I say that's one of the areas where you could have worked with people who had knowledge of getting that right. But overall, at the end of the day, our vaccination rates have been high. It's one of the things that's most helped rates come down in aged care homes. It's one of the reasons it's so much now safer to open schools again.
I just want to come in on that, Peter, to you, because certainly that early part of the vaccine acquisition phase, there was a bit of a Hunger Games playing out internationally. But throughout COVID, it strikes me this was a global pandemic, but how much international engagement was there really throughout this? How much cooperation or lack of cooperation was there?
Much less than there needed to be. Look, vaccine nationalism is always going to be around, so we just have to find ways to deal with it. But what struck me about this is here is a global pandemic, and the global response to it was almost missing in action. The World Health Organization, which would normally take the lead in something like this, was constrained because of its political problems, because of perceptions of political power plays at work, so it was not able to play the role it should have. The Group of 20, which, during the global financial crisis, in my view, was central to an effective global response, did virtually nothing. Even the regional organisations that underpin the multilateral system were again missing in action.
APEC and ASEAN.
Yeah, so it's the great misfortune that this pandemic came around at a time where, for broader geopolitical reasons, the multilateral system was getting very clogged up, if not frozen. And one of the things we do need to do in the future is to make sure that the global cooperation element of a response to a pandemic is much, much stronger than it has been.
Yeah, good point.
Rachel Argerman from Opal Healthcare here. I just want to say to the panel that I think your points on the need to learn swiftly from the data that you're getting in is really, really important. And with vaccine rollout, people learned quickly once it was being distributed. So initially we had the vaccine coming in on a taxi sent from one place. We had nurses coming in from the public health unit. Often the nurses and the vaccine arrived on different days, and the vaccine was then too old to use. That lesson was learned quickly. A lesson that wasn't learned quickly was the 100% furloughing of team in residential aged care. When people need 24-hour care, they need 24-hour care, and you cannot send home 100% of the people giving that care. It needs to be risk assessed. Who is the least at risk? Those people must stay until help arrives. But my question is around design, and that takes longer to maybe not to learn, but to certainly to implement. We had people locked down in resi aged care for far too long in wings which never had any COVID in them at all during outbreaks. And while initially perhaps that was justified, when you have separate egress and ingress and different teams coming in, and when ventilation is okay because you have people in singles with en-suites, you do not have to lock down an entire care community of 120 people when you have 6 people on the 3rd floor with COVID.
Right.
What lessons did you learn about design?
Well, I think we learned that you should use a scalpel rather than a sledgehammer, and I think that's exactly what you... and responsiveness to when it doesn't work.
And also visitors as well, like the kind of human piece to that. And this relates to travelling across borders as well, when some people were able to go for business and then others weren't able to go to see dying relatives. I think that human piece needed to come into conversations from the very outset as well.
I would say something else as well. I mean, it's a really good question, because we do argue in our report that when you're designing these programs and you have, bureaucratic guidelines, you do have the ability to address them compassionately. You also have the ability to do it in the common sense. And because you've got a guideline which says that, if you have these people in aged care home, anyone on that shift, you've got to, take them all out without saying, well, who are you going to put in there to replace them? That was the sort of problems that were going on. So I think that what you're talking about isn't just aged care. There was a lot of that where people were following these bureaucratic guidelines. And hopefully we learned fast, often not fast enough, that some of these made no sense when you were actually trying to administer them. You were actually making things worse, for example, in those aged care homes.
Well, speaking of those on the front line, I think we've got a question from someone who became a pretty well-known face during the pandemic.
Jamal Rifi, general practitioner, retired, in the Canterbury Bankstown area. Lockdown definitely stops the spread of the virus across the fault line of societal and geographical area. But combining the lockdown with a curfew made the situation a lot worse in Western Sydney. And we need to learn that they need to communicate with people on the ground and don't make the decision across the harbour bridge. Thank you.
Jamal Rifi, let me just ask you quickly, just hold on to the microphone there for a tick. Was there any consultation with you on these sorts of issues? Because you were doing a power of work in communicating important pandemic information in the community. Did they talk to you much about these questions of curfew and so on?
I definitely talked to them, but they haven't talked to me. Because I was sending even SMS messages on a daily basis.
Right.
And I was alerting them to the fact that the pop-up clinic was an incubator and a spread of the virus itself, because people lining outside were actually not keeping their social distances and that sort of things. At the same time, I was telling them that if you want to vaccinate people in this area, don't expect them to go to Homebush. You need to bring the vaccines to them. And initially, there was a lot of reluctance. And I honestly got sick of just sending messages on SMS and that sort of things. We tried to fill in the gap. And I reckon we've done a pretty good job overall. And we tried to let them know that not only English-speaking citizens get affected by the COVID.
Exactly.
And also our messages actually shouldn't be spread just by English only, because we are as strong combating the spread of this virus as the weakest and health illiterate community in our society.
That's a good point. So this...
David, can I just make, because it's such a good point.
It is.
And one of the things that came out of our consultations, and people were being very honest, and it was fascinating, I think, to see two views, because public servants, very good public servants that I admired, would say, well, we did have these committees and we did consult with communities. What is interesting is that the people on the other side, whether they were from business or unions or civil society organisations or Dr. Riffy's, were saying, no, we weren't consulted. We were told things. We were informed about things. So it's very interesting in this situation where one person's consultation can be another person's just being told and having no influence to really feed back or have influence.
And is that one of the important lessons here?
Absolutely.
Too? Every community is different. Engagement between decision makers and individual communities needs to improve.
I think, look, we've been talking about now, why didn't we have a national approach? But here is the truth. COVID is local. I mean, one of the things we didn't actually consult with enough was local governments. The other thing is that, and we have learned from vaccination rollout is a really good example of actually it is when you work with frontline civil society organisations, it often have much more positive effect than staying a level or two levels above that. Yes, that is one of the things we've got to learn. And I think every government, every set of public servants has actually now got quite a lot of rhetoric about higher levels of citizen engagement and human-centred co-design. And one of the things that comes out of that, it's actually tends to still be at the periphery of public administration rather than being at its core. Now, we should learn not just from this crisis how important it is, but generally that, you know, that ability to take a place-based approach to national things and to do it through civil society organisations and leaders is absolutely crucial.
Look, I think on that point, it's and looking at the time, I'm conscious everyone's got busy days. We might wrap it up there, but I do think that's an important point to finish on. One of the powerful lessons here, that level of engagement. I think also your overarching lessons about social fault lines being front and centre, and the need to constantly review and assess what's working and what's not, rather than set and forget, I suppose, are some of the key lessons here. I've really enjoyed this conversation to reflect on what we've all been through over the last few years. There will be, no doubt, reports and commissions and so on that follow, but you've done a terrific job here, and all of the team behind this report and the consultations, the hundreds of consultations that have gone into this work. So please thank all of our panellists for the review. And thank you for some great questions this morning and for coming along. We'll see you soon.